Hi, my name is Samantha Rossetti and this video is to demonstrate the correct airway management techniques used on an unconscious patient, as well as to recognise errors that may occur when using these techniques. This video was filmed on the 5th and 12th of October 2012. So now we're going to put the patient in a lateral position. So what you do with the furthest arm, you put it out, 90-degree angle. With the closest arm, you put it across the chest, and with the closest leg, you bend it up. Now with your hand under the shoulder and the hip, you gently roll the patient over. Now, if you don't have the leg closest to your bent, when you roll the patient, they will roll onto the ground. So just make sure that the legs are up. So now I'm going to perform a triple airway manoeuvre. Now, this is needed in order to have a good airway. It also allows for better air entry to go into the lungs. So what we want to do first, we want to make sure that the ears are in line with the clavicle. This lengthens out the airway and just gives us a better space for the air to go in. So what we're going to do is we're going to put a towel underneath the head. So just lift up the head, place that under. We can see now that the ears are in line with the clavicle. Now with one hand you do a little head tilt and with the other you do a chin lift. Now this is also known as the sniffing position because it looks like they're sniffing. The difference between the sniffing position and the triple airway manoeuvre is that there's a jaw thrust in the triple airway manoeuvre. So after you've done the head tilt and the chin lift, you do a jaw thrust. So that's just on your jaw. The bottom teeth should be above the top teeth. Now, a common error that can occur is that you can hyperextend the neck. The pillow does help for this not to occur. So once manual clearance has occurred and the triple airway manoeuvre has been performed, you can put in your OPA. So what you have to do, measure it from the corner of the mouth to the angle of the jaw. So we're using the yellow one today. When you put it in upside down. Once this, make sure that the tongue doesn't get caught and fall back. Then you twist it around and just place it in. It should go in pretty easily. It'll sit on the lips. Make sure that the lips aren't being pushed and forced onto the teeth. Make sure when you've got it in, you check for a gag reflex. And taking it out is exactly the same. You just do it in the opposite movement. A common error that can occur is that your OPA can be too big or too small. You can clearly see that from it's far too big. When it goes in, it won't be able to fit. It'll sit far too above the jaw, above the lips, so that won't work correctly. So you simply just take it out and put in a smaller one. Okay, so now I'm going to put a nasopharyngeal airway. Now you can put one of these in if the patient has trismus and you can't get an OPA in. Just be careful, if there's trauma to the head or suspected brain injury or the middle third of the face, you can't put one in. Once you do have one though, if everything's alright, you measure it from the side of the nose to the ear, so this one's the right size. Have the angle pointing into the nose and simply twist. Don't push too hard if you get an obstruction, and then it should sit nicely in the nose. A common error that can occur is that the tube can be too big. If this happens, it'll become an obstruction down in the airway and cause problems. I'm going to show you the correct technique of using a laryngoscope. What we want to do first off, we want to make sure that we're behind the patient's head. So the nose should be up. This gives a good view into the airway. Now with your right hand, I want you to hold the head. Make sure it's secure. With the left hand you hold the laryngoscope. Make sure you check that the laryngoscope is working correctly. The bulb should turn on when you open the laryngoscope. Now you go in on the far right side, making sure you're not hitting the teeth, and we want to just push that tongue over. Making sure that you're still checking for obstructions. Keep going in. Now you'll hit the molecular groove, which the laryngoscope should sit in nicely. Now once you've got the laryngoscope in there, you can gently pull up like you're pulling up a bowling ball. If there's any obstruction, you should be able to see it. Now you can get that obstruction out by using forceps or suction. Once the obstruction is clear, you should be able to see the vocal cords. An error that can occur with this movement is angulation. So when this happens, you can knock the teeth out and the teeth can then fall into the airway and become an obstruction which wasn't already there. We are now going to apply positive pressure ventilation using the bag valve mask. Now what you have to do, make sure your OPA is in, or if it's not in, insert it. This ensures that the tongue doesn't fall back and obstruct the airway. If you can't put an OPA in, put a nasal pharyngeal airway in. This just ensures that you will get some air into the airway. Now we have to make sure that we have the right size mask, so just measure that one, make sure it covers both the nose and the mouth adequately. Now using your left hand, put your thumb and index finger over the mask. Make sure you have it securely around the face. You want this seal to be leak-proof if possible. An error that can occur if you don't have a correct seal, you will get air leaking out and you will not get the rise and fall of the chest. So with your thumb and index finger over the mask and the rest of your fingers just on the angle of the jaw. The effects of this when you have a tight seal is you should be getting rise and fall of the chest.